last video about me weaning off of the medication Dupixent. Um, got a pretty interesting response. I got a lot of responses from a lot of viewers, and I wanted to elaborate a little bit further and also just explain about some of the things that I do during the winter to deal with the things that people who are suffering with eczema tend to deal with, such as excessively dry skin, things of that nature. As I explained previously, me personally, I don't use any medication. I haven't used eczema medication, and it's getting to close to 3 years now since my last Dupixent injection, which was like February of 2018, I want to say. So it's almost 3 years. And as I explained before, the reason why I don't use that medication is because I experienced some side effects like brain fog, and I didn't like that because I felt like it was affecting my work a little bit. And that's just me personally. I also saw that I had some not allergic, but my left eye tended to have some dryness more than usual, and I'm somewhat prone to allergies as well. So especially if I'm in a dusty area, that sometimes happens and I fall asleep. But I was experiencing a little bit of dryness as well. So I decided for that reason to wean off, and what I did is to supplement that to kind of replace that medication was, as I was explaining before, is now I try to at least eat probiotics like Greek yogurt at least once a week. Also something with omega-3 fatty acids, specifically from fish. Like I try to eat tuna or salmon. Before I used to take fish oil tablets as well. I do that about once a week. And those are fish oil has natural anti-inflammatory properties to it, as well as you can look up the study of probiotics and how it affects immune-related conditions, and you know, eczema, allergies, asthma. Those are all immune conditions where our immune systems are somewhat hypersensitive to certain things, or they overreact in certain relations, and there's certain proteins that are causing our skin barriers to break down quicker than, I guess, a regular skin barrier would. So I'm not a medical professional. I'm not a doctor, nurse, or anything. I'm just someone who has experienced eczema since I was 4 years old. So I don't, you know, I'm just saying, and I would always go with the advice of a certified medical practitioner over what I'm, you know. But I can only give you my experience as someone who's been afflicted since I was young, of course. So, you know, during the winter, I try to see, what I usually do is if I'm not active certain days, I may skip a day of showering. And I know that doesn't sound the most hygienic, but I'll explain why. Because showering very often, like 2-3 times a day, if you're in a very cold environment, can actually tend to strip your skin of its natural oils. The skin actually produces a natural oil that protects the barrier of your skin, and especially if you like to use a lot of perfumed soap and things like that, that can further irritate your skin and dry it out or cause it to rash. I would also recommend using natural soap. I don't really have it with me, but I use a soap that's actually made of shea butter. You can look up natural black soap. There's which is like, I think it uses charcoal. There's this soap that it's also consists of like shea butter and charcoal and stuff like that, you know. And those products are actually and whether you have eczema or not, those are actually more holistic and healthier products than a lot of like perfumed stuff. The lotion I use, I just, you know, now I tend to use as well lotion that is not perfumed or doesn't have like those scents that are added to it. Body wash that is, you can look at hypoallergenic body wash and lotion. You can also look at Aveeno lotion with oatmeal naturally in it. It has oats and oatmeal also naturally has anti-inflammatory properties to it, and I eat oatmeal like 3 or 4 times a week as well. Also try to use Vaseline and different lotions immediately once you come out of the shower. When I had a very extreme eczema, when weeping skin, that's what I did is and when I get out of the shower, do not, especially if you're living in a very cold environment, do not rub your skin dry with a towel. What you should do is you should pat it dry. Put a layer of lotion, preferably Aveeno or Dove or something, unscented lotion, then put a layer of Vaseline over it, and it seals your skin and protects it. So basically, those are just a few of the tips that I wanted to give out, and thank you guys for watching so much. I'm just trying to explain some of the things that worked for me as well. You can also, if you choose to use medication, or as you are directed by your nurse or doctor, please do so, and please take their advice over mine. I'm just giving my opinion on the things that worked for me, and I haven't used any medication in years, and I've been afflicted with eczema, as I said earlier, since I was maybe 4 or 5 years old. Thank you so much, and have a great rest of your day, and thank you.